Hi, this is Lisa Meadows, the Clinical Compliance Educator for ACHC, and today we're going to talk about what happens after your accreditation survey. So the post-survey process. Once your surveyor is finished with the survey, they will submit all paperwork to ACHC. The ACHC Review Committee will review all of the information submitted and will determine an accreditation decision. Deficiencies are cited at two levels: standard level and condition level. Standard level deficiencies are deficiencies that are considered random. They're not considered a systemic issue with that Medicare condition of participation. We also only cite the ACHC only requirements at the standard level. All that is required after survey, if you have standard level deficiencies, is a plan of correction, which we'll go over in a few minutes. If you have a condition level deficiency, this was cited because there were multiple tags out under one Medicare condition of participation. Therefore, it represents a systemic issue with that COP, and it will require another on-site survey. CMS says the only way that an accrediting organization or state agency can determine that a condition level deficiency has been abated is by conducting another on-site survey. These are the four accreditation decisions. Accredited means there was no deficiencies found during your survey. Accreditation pending means there were deficiencies found. They were found at the standard level, and therefore a plan of correction is all that is required after survey. Dependent means that a condition level was cited. Even one condition level deficiency will result in a dependent level survey. And a dependent level survey means that we have to come back out on site to determine that that condition level has been abated. Denied means that things were so significantly wrong that ACHC has decided to deny your application or your accreditation, and you will need to start over with the application process. Here is a sample of a summary of findings. The nice thing about how our summary of findings is written is that it identifies the standard, but it also identifies the specific COP standard that was out of compliance as well. So you can reference the COPs to determine exactly what is required to be in compliance with that standard, and that is how you will then determine to build your plan of correction. You will receive your plan of correction template from your account advisor after your survey. It is due to ACHC within 10 calendar days. The identifier is pre-populated on the left-hand side, so we will identify which deficiencies need to have a plan of correction. That plan of correction is that action step. That is the step that you as the agency take to put yourself back into compliance with the requirement. This action step needs to be specific to what you are going to do to determine or to put yourself back into compliance. Usually this action step requires re-education of your staff. It may require a revision of a contract or a revision of a form or even a revision of a policy and procedure. Make sure your action step specifically addresses the type of deficiency that you were cited at. The date of compliance. If you were cited at a standard level deficiency, you have 30 days to complete your action step. You may actually turn in your plan of correction prior to completing that action step, which is acceptable. If you have a condition level deficiency, you will have 10 calendar days to complete that action step, and that is a CMS requirement. Then you will enter the title of the individual who is responsible for that issue. And then you're going to put the process to prevent recurrence. And this is a two-step process. Your first step typically involves a high frequency, high volume chart audit. the majority of deficiencies come from the medical record. So you're going to audit a high percentage of your charts frequently until you meet your targeted threshold. Once you meet that targeted threshold, you don't want to continue auditing at a high volume, high frequency level. You want to be able to work on other things. But what you need to tell us is how you're going to maintain that ongoing compliance. And this can be as simple as you're going to continue to audit this issue on a quarterly basis. This is what your plan of correction template looks like. As I said, it will come to you from your account advisor. It is autofill, so you can type in your company's information. There are instructions here that specifically tell you what it is that you need to do. You will notice that you are going to need to audit at least 10 records or 10% of your daily census on at least a monthly basis until that threshold is met. And then you will see we provide you with 2 samples here. Once your plan of correction is reviewed and approved, the clinical review specialist will identify if you need to submit evidence. When your plan of correction comes back to you in the evidence column, it will have a yes if you need to submit evidence. If you don't need to submit evidence, it'll have a no. What we want you to complete is this form here. This form will be sent to you after your plan of correction is approved. This is a great form for you to summarize your evidence on. We don't need you to send in any of your in-service records or your PowerPoint presentations, any of your other educational materials. What we want to see is the outcome of that action step, and that's what this evidence chart summarizes. You'll identify the deficiency, provide a brief description of what you did, how many charts you reviewed, how many were correct, and what that percentage equals. And we'll compare that to your identified threshold on your plan of correction to ensure that your plan of correction was effective. Now at the bottom you will see sometimes you will send in a hard document, such as an incomplete contract, but the majority of your audits, because the majority of your deficiencies are going to come from your medical record, we want you to summarize this information. We do not want any confidential or protected health information sent to us. All evidence must be submitted within 60 days to your account advisor. Do not submit your evidence until your plan of correction has been approved, and please submit all of your evidence at one time. And again, please do not send any protected health information or any other confidential information of your patients or employees. If you do, we will have to return it to you. Accreditation can be denied based on the lack of evidence to support the plan of correction was effective. So make sure you do keep track of your datelines and submit your evidence timely. If you want to formally dispute a deficiency on your summary of findings, you must do the following items. You must submit a written request to your account advisor that outlines the specific standard you wish to dispute within 10 calendar days from the receipt of your summary of findings. Along with that letter, you must submit the evidence to support that at the time of survey, you were in compliance with the standard. Now, if you are on electronic medical record, we will ask you to also submit your audit entries, your activity log, so we can also see the date of when entries were entered into the medical record. Any areas that were corrected on site during the survey are not able to be disputed. CMS says you have to be in compliance at the start of survey. So if you correct anything during survey, which we encourage you to do, CMS does require that that is still scored as a no on your summary of findings, and therefore a plan of correction will still be required, because we do want to see, and CMS wants to see, that you're going to put a plan of correction in place to prevent that non-compliance from occurring. And again, do not submit any documents with PHI. You will need to cross out patient name and just put the initials or some other identifying information there for us to know who that document belongs to. And again, any activity logs or data entry logs will be required to be sent in if you have an EMR system. ACHC will not review any evidence for dispute if the information is submitted after the 10-day calendar timeframe or the agency is not current with payment or has an outstanding balance. So let's discuss some of the benefits of partnering with ACHC. ACHC has created numerous educational resources that are available not only to help you with your survey, but to help you maintain compliance throughout that 3-year cycle. ACHC has numerous educational resources to help you not only prepare for survey, but maintain compliance throughout that 3-year cycle. On Accreditation University, which is at accreditationuniversity.com. That is where you can purchase our workbooks, you can sign up for workshops, and we also have several free webinars, and we are going to continue to build that website as well. So you need to visit accreditationuniversity.com frequently. It doesn't require a sign-in. You can just go to that website and look at the resources that are available for home health. We also have several online resources, either at achc.org or on Customer Central. The Surveyor, which is a twice-a-year newsletter. We have regulatory updates, we have accreditation resources, and we have the Maintaining Compliance checklists. We also do email updates, the Did You Knows, which come out monthly. That is something that you want to make sure that the appropriate people within your organization are on our email list to get this Did You Know. You may want it to be just one person and you distribute it as you see fit within your office, or if you want other key members as well to receive these monthly emails, let your account advisor know and we can add those emails to our mailing list. Also, we have the ACHC Today, which is a bi-monthly e-newsletter as well. So again, please make sure that we have the appropriate emails so everyone can take benefit of the resources that we have. The Regulatory Updates is a great resource that you can go on to achc.org, click on Resources and Events, and scroll down and click on Regulatory Updates. This is a website that is reviewed frequently and will have any state-specific proposed or adopted legislature as well as CMS updates, so you can filter for your state as well as your program. And again, Customer Central has a lot of resources on it. There are educational tools, the Did You Know emails, the ACHC Today, as well as industry links. So please go to cc.achc.org frequently to get the most current information. Maintaining Compliance Checklist. We've created a series of checklists to help you maintain compliance throughout that 3-year cycle. You can go to customercentral.org, click on Resources, click on Continued Compliance, choose Home Health, and you will see the 4 options there. There is a brief letter about the renewal accreditation compliance resources. Then there is a 12 and a 24-month compliance checklist. These lists are very specific. They identify those items that need to be reviewed frequently. Sometimes it's annually, and that annual requirement sometimes is what agencies forget about. That year tends to come around very quickly. But these are just checklists for you to use to audit yourself on an annual basis to make sure you are staying in compliance each and every year. These are not something that we're going to look at when we come on survey. They're not something that you need to submit to your account advisor. They're just here to help you maintain compliance throughout that 3-year cycle. And then again, there is the items needed for on-site survey. And this is a great list to use about 6 months prior to your survey to start gathering that information, auditing that information, and ensuring that you are in compliance with all of the requirements. We also have marketing resources that are available to assist you with the marketing of your accreditation. We have the ACHC brand guidelines, which you can find on customercentral.achc.org. It lets you know how to use our logos as well as the window cleaning, places to utilize and market your accreditation. You've done a lot of work, a lot of hard work, and you really want to take credit and let your referral sources know that you've gone through accreditation. You've said, we demonstrate a higher quality of care by going through an accreditation survey. These are what our logos are. And here are just a few basic places to promote your ACHC accredited status: on your own website, on your marketing materials, in a press release, social media, promotional items, as well as in your own email signature. ACHC also has a sample press release that they can provide to you where you just enter your information into the press release, and then you could submit this to, again, to your referral sources, to the newspaper, to other media outlets, to promote, again, the high quality care that you deliver and the fact that that's been validated by an accreditation survey. If you have any questions about our marketing resources, you can contact the marketing department, and here is their information. After you receive your accreditation decision, you will also receive a customer satisfaction survey. We really do value your feedback and would appreciate it if you would take a few minutes to complete this survey. Any questions about this presentation, the resources that ACHC has to help you with survey, our standards, or any other questions regarding the accreditation process, please contact your account advisor. Thank you and have a good day.